You've just been told you tested positive for HPV. Your mind races. Is this forever? Will it turn into cancer? Is there a cure? First, take a breath. You're not alone. Millions have received the same result. And in this episode, I'll walk you through exactly what happens after an HPV diagnosis. Because while HPV can sound scary, the truth is you have more control than you think. Let's get this straight. There is no medication that kills the HPV virus directly. There's no pill, no injection, no instant cure. But here's the good news. In 90% of cases, your immune system clears the virus on its own, usually within 2 years. That's right. Most people who test positive today will test negative in the future, with no treatment at all. Your body is capable of fighting HPV naturally, especially if you're healthy, under 30, and not deal with a high-risk strain. Once you've tested positive, what happens next depends on your sex, age, and the type of HPV detected. If you're a woman, you'll likely have one or more of the following: a follow-up pap smear, an HPV DNA test to identify the strain, a colposcopy, a closer look at the cervix, possibly a biopsy if abnormal cells are found. If you're a man, routine screening isn't common, but if symptoms like warts or throat changes appear, your doctor may recommend visual examination, anal pap tests for men who have sex with men, referral to ENT if oral HPV is suspected. The goal is not just to monitor the virus, but to catch any cellular changes before they become cancer. While there's no cure for the virus itself, the effects of HPV can be treated. If you have genital warts, treatments include topical creams, cryotherapy, freezing the warts, surgical removal, laser therapy. If you have abnormal cervical cells, your doctor may recommend watchful waiting with repeat testing, LEP procedure, removal of abnormal tissue, colon biopsy, a deeper tissue sample. These treatments do not eliminate the virus, but they prevent the virus from causing more serious damage, like cervical cancer. Here's a question many people ask. If I had HPV and it went away, is it gone forever? Not exactly. In some cases, the virus can lie dormant, inactive, undetectable, and harmless. But under certain conditions, like a weakened immune system, it can reactivate. That's why follow-up testing is key even if you feel fine. There's no miracle cure, but you can support your immune system to give it the best chance. Quit smoking. Eat more fruits and vegetables. Reduce stress. Get enough sleep. Avoid unprotected sex with new partners. Stick to follow-up screenings. HPV isn't just a virus. It's a wake-up call for your overall health. So, can HPV be cured? Not with medicine, but in most people, the body takes care of it naturally. The key is to monitor it, treat its effects, and support your body. In our next episode, we'll talk about one of the biggest tools in prevention, the HPV vaccine. Who should get it, how it works, and why it could save lives. If you made it this far, give this video a like, subscribe, and share it with someone who needs to hear this. HPV isn't the end. It's the beginning of taking your health seriously.